Everyone, welcome to my channel Fam Talks with Meso, who miss me. Okay, on today's channel we are going to give you a mind-blowing topic which most of us has always been wanting. But before that, please make sure you like, comment and subscribe to my YouTube channel. Also turn on your notification in case we drop any hits, because we'll be dropping it steady by time. Okay, we'll be dropping it. We will never go a day without dropping any mind-blowing topic for you. Okay, now go to the topic of the day. Okay, today we'll be talking about contraceptives. Okay, contraceptives, what are they? Contraceptives are things contraceptives are things we take or use to hinder pregnancy. Okay, and in these contraceptives we have many types, and people are confused on which one or how to use them. Okay, some people are confused because of the side effects and other things. Let's start from here. Okay, combined pills that are also known as pill. It contains synthetic female hormones, estrogen and progesterone. Okay, it is hormones in the pill that mimic the ones made naturally by the ovary. Okay, this pill is usually taken to prevent pregnancy, but can also be used to treat painful periods, heavy periods, PMS, also known as premenstrual periods, and also endometriosis. Okay, at a glance, let's talk about the combined pills. These combined pills, it helps a lot. Okay, but before you take any of this, you have to go and meet your doctor and tell him or her the type of contraceptives you want to go for. Okay, how does the pill work? The pill thickens. It works by thickening the mucus in the neck of the womb, so it's harder for sperm to reach an egg. Okay, it thins the lining of the womb, so there is less chance of a fertilized egg implanting into the womb and being able to grow. Okay, let's go on to the second one, condoms. Okay, we have two types of condom. We have the male condom and the female condoms. Okay, condoms worn by men are made from very thin latex. Okay, they are made from very thin latex, polysoprene or polyurethane. Okay, they are designed to stop a man's semen from coming in contact with his partner's sexual organ. Coming in contact with this partner's sexual. Oh, sorry, I was too fast. They are designed to stop a man's semen from coming into contact with his sexual partner. Okay, it is the only contraceptive that protects against STI and also pregnancy. It has two works. If you are using any of these contraceptives and you have multiple partners who you are not sure of, please make sure you use your condom. It is very important. Okay, let's say that you are having an intimacy with your partner. At some point the condom slips off. Please make sure you get PEP. It is post-exposure prophylaxis. In case you are not sure if that person, in case you think the person has HIV and you are not certain, please make sure you go to your clinic or to a health clinic and get PEP. It is called post-exposure prophylaxis. Okay, now to the third one, we have contraceptive injections. This contraceptive injection lasts for weeks. It can be 8 weeks, it can be 12 weeks, but it lasts for months. Okay, depending on the one you are going for. There are three types: Depo-Provera, Cyana-Pres, or Noristerat. Okay, it is 99% effective. Also condoms too, they are 99% effective. Combined pills, please, if not taken normally, if not taken the way it is supposed to, because you take it every day and in 21 days you give a gap of 7 days, it will still be working by then. You give a gap of 7 days and continue taking. But please, this contraceptive injection, it is 99% effective. Okay, but please, it does not inhibit STI. It does not stop STI. It does not stop you from coming in contact with STI. Okay, let's go to the next one, contraceptive implant. This is the one that is put on the arm using surgery. It is put in your underarm, okay? It's inserted under the skin of your upper arm by a professional. You don't do it yourself. It stops the release of an egg from the ovary by slowly releasing progestogen into your body. And this implant lasts for at least, you can see the one that lasts up to 3 years. 3 years. Okay, you have the, if you can have the contraceptive implant fitted after you have given birth, usually after 3 weeks. Okay, if it's fitted on or before day 21 after the birth, you'll be immediately protected against becoming pregnant. Okay, even after any miscarriage or anything of sorts. It works for 3 years. It does not interrupt intimacy. It has many advantages. Okay, and it also has disadvantages. See, everything that has an advantage has a disadvantage, in as much as you need one of these. If you are a person that does not need a child at the moment, you need one of these. Okay, the disadvantages of contraceptive implant is you can feel headache at any time, but it is temporary. It's not something that comes frequently. Okay, it just comes occasionally. Acne, nausea, breast tenderness, changes in mood, or loss of intimate drive. Okay, bear with me, due to YouTube violation rules, I don't want to make mention of the exact word. All right, so let's go to the next one. Contraceptive patch. This is a patch. It is placed on your skin. It is a sticky patch, a bit like a nicotine patch, measuring 5 cm by 5 cm. It delivers hormone into your body through your skin. You can put it anywhere where you know that nothing can shift it, nothing can obstruct it. Okay, it prevents ovulation. It thickens cervical mucus. Okay, it thins the womb lining too. These are things that make getting pregnant hard. So let's talk about the diaphragm. The diaphragm. Okay, so what is a diaphragm? A diaphragm is a circle of silicone. It is inserted into the V part of a lady before intimacy to cover the cervix so that sperm can't get into the uterus. You need to use spermicide with it. If you are making use of it, you need to get a spermicide, because spermicide it kills sperm. Okay, you need to use it. So it must be left in place for at least 6 hours after intimacy. Take note of it. It must be left 6 hours after intimacy. After then, you take out the diaphragm and wash it. They are reusable. But take note, it must be left there 6 hours after intimacy. Okay, it is 92 to 96% effective at preventing pregnancy. Before using, make sure you get your size. So the next one is female condoms. I already spoke about condoms. Okay, so let's move over to, let's talk about it. Female condoms. Okay, they are made from thin soft plastic called polyurethane. Okay, some male condoms are made from these too, but this female condom, they are worn inside, not outside the V part of a lady to prevent semen getting to the womb. It is very good for prevention of STI. Condoms, take note, condoms are the only contraception that protects against pregnancy and STI altogether. It is 95% effective. Let's move over to female sterilization. It blocks the fallopian tube, which link the ovary to the uterus. Eggs will still be released from the ovaries as normal, but they will be absorbed naturally into the woman's body instead of going out. Okay, though it is usually done as an operation. It is usually carried out under general anesthetics. Okay, so this is done by a professional. It is usually done as an operation, but it also has its own disadvantage. There are small risk of complications. This can include internal bleeding, infection, or damage to other organs. There is a small risk, that is if the operation does not work. Okay, If the operation fails, it may also increase the risk of ectopic pregnancy. Ectopic pregnancy. I wouldn't want to go into ectopic pregnancy. We are talking about contraceptives. I'm just telling you the ones that works. All these are contraceptives. It depends on the one you want to go for. If you want to, you can browse furthermore about it and know the one that suits your body. But when you get to the hospital and you tell them, I want a contraceptive for myself, they will know the one that suits your body more. Okay, so let's go over to IUD. IUD means intrauterine device. Okay, it is a long-acting reversible contraceptive method. This means that once it is in place, you don't have to think about it every day or each time you want to have intimacy. There are several types and sizes of IUD. You can use it whether or not you have children or you had children. Anyone can use it. Anyone can use it, okay? Having it put in can be uncomfortable. Ask your doctor or nurse about any pain relief that will help you. Okay, there are different sizes and different styles. It lasts up to 3 years. Okay, so if you, after fixing it, if you have any complication, if you have any complaint, please go back to your doctor or your nurse, okay, to check for checkup, to check it, because it is very important. So the next one we'll talk about is the IUS. IUS. What is IUS? IUS is a long-acting reversible contraceptive method. It works for between 3 and 6 years. Okay, this one lasts more than IUD. This is a system, that is a device. This lasts more than the IUD. It is a long-acting reversible contraceptive method. It works for between 3 and 6 years, depending on the type. So you don't have to think about using a contraceptive every day. Okay, so after being fixed, if you have any complications, make sure you go back to your doctor. Let's talk about POP. That is progesterone only pill. POP, okay. POP is a method of contraception. Yeah, it contains the hormone progesterone but doesn't contain estrogen. It contains progestogen but it doesn't contain estrogen. Okay, it only thickens the mucus in the cervix, which stops sperm from reaching an egg. It can also stop ovulation. Okay, it is 92% effective. But in this type, you take a pill every day with no break between packs of pill, unlike the combined pills. In the combined pills, you are going to be taking a pill for 21 days straight, then you give yourself a break of 7 days. But in this, you have to take every day. In POP, you take every day, no break at all. Okay, so before you use any of this, please make sure you relate to your doctor. If you have high blood pressure, if you smoke, if you are over 35, make sure you relate any of this to your doctor so that he will know how and what to do. So let's move over to vaginal ring. Okay, this is another type of contraceptive. It is a small soft plastic ring that you place inside your V part. It's about 4 mm thick and 5.5 cm in diameter. Okay, you leave it there for 21 days, then you remove it and throw it in the bin, but not down the toilet, please, in a special disposable bag. 7 days after removing the ring, you insert a new one for the next 21 days. Okay, so you give yourself a break. After 21 days, you remove, give yourself a break of 7 days. Those 7 days, nothing is going to happen. I think that's how it works. Nothing. Even if you will not get pregnant. Okay, so don't panic, but make sure it is not more than 7 days. So after 7 days of removing the ring, you insert a new one. Okay, so the ring releases estrogen and progestogen, which prevents release of an egg and also thins the womb lining. Okay, now let's go over to vasectomy. This is a permanent method. Okay, it's a minor operation that stops men being able to get a woman pregnant. I think this is done on a man. Oh, sorry. It's a minor operation that stops men being able to get a woman pregnant. The tube that carries sperm from a man's testicle to the penis are called blocked or sealed. Vasectomy is usually carried out under local anesthesis and it takes about 15 minutes. Okay, this is done on a man. In most cases, vasectomy is more than 99% effective. Out of 2,000 men who are sterilized, one will get a woman pregnant during the rest of his lifetime. Okay, so in this type, it is done in men. It is men that go through this. Okay, this local anesthetics. It is men that go through it. Then the last one is natural family planning. Natural family planning. Okay, we all know what natural family planning is, but let me still go into details. Okay, this works by plotting the time of your cycle when you are fertile and when you are not. You learn how to use and record fertility signals to identify when it's safe for you to have intimacy. Okay, you calculate your ovulations and know when it's safe for you to have intimacy. And you know certainly during your ovulation period, if you have intimacy with anyone, you will get pregnant. Okay, that's all for today. Thank you for watching. Please do well by subscribing, liking my YouTube channel. Thank you and remain blessed. God bless you all. Thank you. That should be all for now. These are the permanent methods: vasectomy and female sterilization.